Good morning. I'm George Van Horn from the Woodlands, Texas, and I'm in favor of health care reform, but I am totally opposed to the current bills that are being offered in Congress. And the reason is that I'm opposed to a government takeover of the health care system. I don't want a government-run program. I know that it will inevitably lead to rationing, which means that especially older people are going to suffer because their care is going to be curtailed, and also people with serious diseases such as people with cancer and heart disease are going to suffer because those care programs are expensive, and because by the government taking over the health care system, it's going to eliminate a lot of the important research that's being done into life-saving care. Thank you for your attention.
Hi, my name is Libby Feaster. I'm 20 years old from the Woodlands, Texas. With this health care reform, I'm watching the United States strip away the freedoms that Americans have enjoyed for 200 years. Part of what the Constitution says is that you're supposed to protect these freedoms for your posterity, and you are failing my generation in doing that. You need to vote against this bill, which is going to strip away my freedom to choose health care for myself, which I believe I can do better than the government. So thank you, Kevin Brady, for voting against this.
Hi, I'm Becky Feaster. I live in the Woodlands, Texas. And I would like to take a minute to just say thank you, Kevin Brady, for voting against this and working against this health care bill. One of the things I am not hearing anything about is tort reform. I grew up the daughter of a lawyer. I know what's involved here. The lawyers have shot these costs up dramatically in health care. Our doctors have to do multiple tests, and then they have to have large malpractice insurance, and that's not even being addressed, and that's a reform that should take place. So I would encourage everyone to vote against this. Thank you.
Hi, my name is Danielle McCowan. I live in Montgomery, Texas, and I just want to say that as a recent breast cancer survivor, I just find it imperative that I would be allowed to continue care with the same people that I've started my care with. I just find my future really relies on this, and so do my physicians. And I just want to say thank you, Kevin Brady, so much for supporting us.
Hey, I'm Brenda Cunningham from the Woodlands, Texas, and my husband and I and everyone I talk to is very much against this health care bill that you guys are ramming down our throats. We know it's going to ruin our economy. We know it's going to ruin the health care that we get in these United States of America. You are taking away our freedoms. You are taking away our freedom of choice, and we do not want this. You need to listen to we the people. Thank you.
Hi, name is Brett Marco. I'm from the Woodlands. I am the owner of a small independent health insurance agency that caters to small businesses, self-employed individuals, and those that aren't covered well via group coverages. I'm on the front lines right now of everything that you guys are working on right now. I deal with people that are uninsurable. I deal with the problems that are faced coming from all quarters, whether that be hospital administrations, lawyers, government entities, and even insurance companies. Yes, some things need to be done, but you don't need to rush into some of the things and mandate it via government-wise. The proposal that is facing, that has been presented to Congress today, would basically put me into the unemployment line and destroy my business completely. Which would allow me not to be able to provide for my family anymore personally. But even more so than that, I worry about my clients, the small independent business people and self-employed people that are fighting every day to build their businesses, that have their concern about escalating health insurance costs, who I get in there and I work with them and figure out what they really need and what they really want to pay for and what their budget is, and get them the appropriate solutions. I see that you guys are talking about the health insurance exchange, where you go to a website and basically they figure out what's best for you. Well, the problem with that, we have that now. It's called eHealth Insurance and other sites like that. And I run across person after person who goes on those things, chooses something based upon the lowest price, and then is astonished that there are holes in their policy based upon that, without any sort of practical guidance. Because let's just face it, the American public does not know everything that they need to know in order to purchase health insurance properly. And you know, there's a lot of things that some people need one thing, some people need another. And one of the main things is that a one-size-fits-all type solution does not cover everybody well at all, and increases costs overall. And you know, just like the you know, some of the doctors say they're doing preventative tests that they don't need because they have to worry about suits. And so that's pretty much what I like to say. And you know, I hope you guys make the right decision.
No, I wasn't ready. I'm sorry. Hi, my name is Jane Beardsley, and I'm from the Woodlands, Texas. And I have a couple problems with the proposed health care. One thing I'm upset about is the Healthcare Advantage plan being discontinued, the supplement for Medicare. My husband, who is a veteran, a Vietnam War veteran, Air Force veteran, served many years, felt it was the best thing the government ever had done for him, and now it's being pulled out from under his feet. When I reached that age, I was going to be on the plan as well. Now I won't be able to. I'm very upset that the senators and congressmen are not willing to put themselves on the same government health plan that you're proposing for all of us. I find that unconscionable. If you can vote for it for us, you should be willing to accept it yourself. And I'm just so upset about so many other things about the this healthcare reform bill, that the Congress people are not being allowed to even read it, that we're not being allowed to see it, that provisions are snuck into it in the dead of night, that people can't even breathe, no less read this bill. The fact that it's being rushed through means that it's hiding an awful lot. And it's just unconscionable. This is not the country I grew up in. This is not the country I want to leave to my daughter and my grandchildren. You have to fix this. You have to do something better. Vote no against this bill. Thank you.
My name is Fern Lucilius. I live in the Woodlands. And I've worked in the healthcare industry for over 30 years. I've retired now, and I would be very happy to be enjoying my retirement. But instead, I'm having to work to try to stop you from doing what you're doing. We have the best healthcare system in the world, and you are going to mess it up completely. We do not need socialized medicine. Vote no on this bill. Thank you.
I'm Alan Guggenheim. I live in Spring, Texas. I was born and raised in Paris, France. I lived there for 28 years, and then I moved to the United States for freedom and free enterprise, and at the time when France was going even more socialist and communist. And now what I see happening in the healthcare bill especially is going exactly the wrong way. It's towards socialist medicine. And let me tell you, I mean, America has the best medicine in the world today. Yes, there are one or two problems. I think that problem is that it's expensive, and people have to understand we cannot afford to have everything that technology can afford. We cannot afford that in medicine for sure, so that's a problem. But also insurance portability, guarantee, you should be able to buy insurance. I think personally insurance should be mandatory for healthcare, because people never want to pay for it when they are healthy, but then when they become sick, they want somebody else to pay for it. And that's not fair. So I think insurance should be mandatory. Insurance should not have any exclusion, any differences, except you can choose a level of insurance that you want. You can buy additional supplemental insurance. So two things. One, France's healthcare system is a socialist system. What it means is that healthcare is rationed. You have to wait to go to see a doctor or hospital. Yes, you don't pay much, but doctors are not paid much either. You pay $35 for a doctor's visit, and the doctors make an average of $80,000, $90,000 a year. So they don't take care of you as well. Equipment, there's absolutely much less equipment for surgery, for MRIs, for scans, for all these kind of things, and they are rationing more and more because everybody's bankrupt in the world on the healthcare. Everybody's spending too much. Everybody's trying to find a way to slow it down. So on the other hand, I want to show an example of another country that I know well because I worked for 10 years for a company based in Switzerland. Switzerland is a good example. I would like Congress to look at their system because it's mostly paid by the people themselves. Employers never pay anything. Everybody has insurance. It's mandatory, 100% coverage. It's very good. The system is healthy. over there they also have a problem controlling cost, and mainly that means that people need to be more responsible. I'm all for a HSA type of coverage. I adopted that in my company a few years ago. It was a small business with about 50 employees, but I put an HSA plan in place with a high deductible, and I talk to my employees to make them understand the reason for it is so that people don't over-abuse. I see some cabinets of people's houses that are full of medicine that is not used just because people over-abuse doctor visits and treatment and medicine for something that good soup or an apple a day, as they say, would take care of that cold. And so when medicine is socialist and it's paid by somebody else than you, anybody, whether it's your insurance or the government, then you have a tendency to go to the doctor for something that before you would ask your mom, or you would ask the pharmacist even for an advice before you go to another extent. So it's a big problem, but I think this bill is totally wrong and is going in the wrong direction. Thank you.